Advice like be calm, don't panic and don't panic buy might be sensible, but day after day any sense of calm has gone out the window, not only on our markets but at our supermarkets, shelves stripped to the bone. Chains like Woolworths maintain they can shore up future supplies, but the supermarket giant has ceased some home delivery services, trying to offset that by opening earlier just for seniors.
Casey Hyde is blind. A disability heightened when she now shops.
Especially being in a line waiting for toilet rolls, and because we can't see, the people behind us are actually stealing our toilet rolls because they're panicking.
As concerns over coronavirus increase, so has panic buying across Australia. In fact, it would reach an unprecedented peak this last weekend.
We will have hit volumes over the last week and the weeks prior that we would have seen more than Christmas or ever in the last 12 months.
The demand such, the chain has been forced to cut or delay home delivery services.
We have suspended click and collect pick-up in all of our states at this point in time and home delivery in Victoria.
But from tomorrow, Woolworths will open an hour earlier at 7 a.m, exclusively for seniors, the disabled and those who care for them.
It's absolutely crowded and there's nothing left.
The shelves are stripped.
There are a lot of people who are having trouble because they can't get here early.
And from Thursday, Woolworths will begin selling what it calls care packages, containing hard-to-find groceries such as pasta, sauce and toilet paper. The supermarket chain says all stores around the country will close earlier on Wednesday night at 8 p.m. to help restock shelves. And meanwhile, the Shop Assistants Union says frayed tempers at the checkout have increased substantially.
Don't lose it over a loo roll. It's not the checkout operator's fault or the shelf stocker's fault that that's the case.
But the confronting empty spaces of shelves will remain conspicuous, and that will be disheartening news for Casey Hyde.
It's just unfair if you have to go to a supermarket when you catch an Uber and there's nothing left.
Mike Dalton, 9 News.
Supermarket giant Coles has followed suit, introducing a community hour, but is going one step further. 9 reporter Tiffany Genders has more for us.
At a time when many businesses are slashing jobs, this is some positive news. The demand for our supermarkets is so out of control. Coles is hiring an extra 5,000 casual employees across the country. Their job will be to serve more customers and replenish the shelves quicker. And Coles is cutting the red tape. The supermarket chain says it will fast track their inductions because it needs boots on the ground as soon as possible.
The world's airlines are banding together, calling on governments and stakeholders for support through the unprecedented challenges. The 3 global alliances want regulators to suspend slot usage rules and evaluate landing charges and fees. Europe has woken up today fearful they are increasingly the hotbed of a virus that is spreading across that continent like an ink stain. In Italy, with infections and the death toll skyrocketing, hospitals are packed with patients, while in Britain, the major airlines are grounding the majority of their flights.
As tension increases across Britain, there are growing questions about whether the UK government is doing enough to combat this virus.
When do you think emergency measures might be brought in?
Obviously the government's going to be saying more things off the me.
That was an advisor to Prime Minister Boris Johnson suggesting new measures could be announced today. Already the country's major airlines have made tough decisions. British Airways to cut capacity by 75% in April and May. In other countries across Europe, residents are trying to stay positive after being told to stay at home. These are the deserted streets of Spain. A moving thank you for health workers fighting the odds to save lives. A nation finding unique ways to come together after being told to keep apart.
Attention, please. An emergency state has been activated. Stay at home.
Ireland acted quickly to shut all pubs and bars after this. A crowded pub in Dublin breaching distancing guidelines and drawing condemnation from the nation's health minister, who said it was an insult to medical staff. Italy, the new epicentre of the pandemic, suffered a record one-day death toll of 368. Hospitals so overwhelmed, authorities are considering denying intensive care treatment to patients aged over 80.
For now, on the streets of London, it is almost business as usual, but that is unlikely to last long. The UK government is discussing new measures, including bans on mass public gatherings and a directive that anyone over the age of 70 stays at home entirely.
The isolation of an entire generation is expected to happen soon.
Well, certainly in the coming weeks, absolutely.
And authorities say it could last for up to 4 months. In London, Ben Avery, 9 News.
Our national leaders have their hands full fine-tuning rules and regulations for containing the virus, as well as reviewing and revising financial strategy. The Nine Network's political editor Chris Uhlmann joins me from Parliament House. Chris, major new measures to stimulate the economy seem certain.
Yes, Pete. Remember, it was only 4 days ago that the government shovelled out $17.5 billion to try and stave off the recession it fears will come with this health crisis. Today, we learn that the Prime Minister and his money men are fast-tracking more measures to support an economy they clearly believe might collapse. And it's not the disease that will kill it, but the cure of closing down the entire country to try and slow the progress of the virus is like an aggressive form of chemotherapy that's killing healthy cells along with sick ones. And that prescription is being written by Australia's chief health officers.
Meet the 10 most powerful people in Australia.
Our aim, as we all know, is to control the spread of this virus.
A gathering of doctors that most have never heard of, called the Australian Health Protection Principal Committee.
Yes, it hasn't been a celebrity committee up till now.
Chaired by the Commonwealth's Chief Medical Officer, Professor Brendan Murphy, it includes his deputy and the 8 state and territory health chiefs. And it's the key decision-making body for health emergencies. Now its decisions are dramatically changing daily life in Australia, from shutting down major events to closing the borders.
We have been asked to give frank and fearless medical advice from the beginning, and that's what we will continue to do.
The group will meet for the next 2 days to consider more restrictions, and its priority is to protect the vulnerable, like Indigenous communities and the elderly.
We are finding, particularly in the much older age groups, 80 and above, that the death rate is actually quite high.
It might mean restrictions on visiting nursing homes, but experts warn that carries its own risks.
If that's needed, what we need to make sure is that we don't make people in aged care lonelier.
And it will demand more resources.
We might need more people to be employed in the aged care sector as a consequence of COVID-19, and that needs to be funded and supported.
It's also likely the committee will lower the limits on mass gatherings, as the ban on crowds of over 500 might not suit indoor events.
A football stadium versus a pub, for example.
The Prime Minister is following each prescription almost to the letter and says schools will not close.
I'm trusting the medical advice of those who are responsible for the public health of our nation.
But that advice will change as the disease spreads.
This is about slowing the epidemic. It's not about stopping it completely. We will have more cases.
And a long and bitter winter will follow Australia's black summer. Chris Uhlmann, 9 News.